Thank you very much, Mr. Cunningham. With the Canadian Nurses Association, Ms. Poulin, Director, Policy, Advocacy and Strategy.
Thank you. I've timed my speaking to less than 5 minutes. I'm a registered nurse myself, and I'm here representing the CNA, the Professional Association for close to 140,000 nurses in Canada. I'm pleased to speak today about the measures related to nurse practitioners in Bill C-44. The measures are under Part 4, Division 11, which focuses on support for families, benefits and leaves in both the Employment Insurance Act and the Canada Labour Code. As for Part 1, we are pleased that the Income Tax Act now includes nurse practitioners, or NPs, under the list of healthcare providers who can certify eligibility for disability tax credits. This measure was effective on Budget Day. As our President noted on Budget Day, these changes are long-awaited breakthroughs for patients and nurse practitioners, and we hope they set the precedent for similar modernization of other related legislation. We're thankful that the Minister of Finance included these measures in Bill C-44. Along with the Canadian Advanced Practice Nurses Association, we encourage members of the committee to accept the amendments that have been proposed to both the Employment Insurance Act and the Labour Code. The amendments formally acknowledge and enable nurse practitioners to fulfill their important role as primary care providers, in particular for Canadians who live in rural and remote locations in Canada. Members of the committee are also aware that the Senate Committee on Social Affairs, Science and Technology will be discussing a pre-study on Division 11 of the bill, and we encourage them to support these amendments as well. To have a sustainable healthcare system where services are accessible to all Canadians, health professionals must be permitted to practice to their full scope of regulated qualifications. For nurse practitioners, these qualifications include the ability to perform comprehensive patient assessments and complete related documentation. I'll give you a brief overview of the nurse practitioner role to illustrate the benefits of these amendments. Nurse practitioners are registered nurses with additional graduate level education and extensive specialized healthcare experience. Protected title and regulated across Canada since the early 90s. Today, almost 5,000 nurse practitioners provide care to over 3 million Canadians. Within their scope of practice, they conduct physical assessments, they order and interpret tests, they can admit and discharge to hospital, they can prescribe medication. As you know, they can provide medical assistance in dying. They complete advanced practice examinations, and they must be registered with their nursing regulatory body in order to practice. While nurse practitioners work in diverse settings, urban and rural, they are commonly the first point of contact for primary care, particularly in rural and remote communities. Like many primary care practitioners, it's not unusual for nurse practitioners to have a patient panel of over 10,000 patients, so it's a very broad in scope. And to illustrate the scale of care provided by nurse practitioners, if you just look within First Nations Inuit Health Branch, nurses, the nurse to physician ratio in rural and remote communities is primary care is provided at a ratio of over 26:1 nurses to physicians. They truly are the gateway to care. From this, it's clear how outdated legislation drafted before nurse practitioners were recognized as a protected title and became key primary care providers. These barriers are real, and they prevent access for many Canadians, and in particular for Indigenous peoples, where the most local care is likely through a nurse practitioner. By including nurse practitioners among those who can complete documentation, such as the medical certificate for employment insurance compassionate care benefits, patients will have increased access to benefits to which they are entitled. Unnecessary personal costs to individuals will be avoided. Duplication in services between nurses and physicians will be reduced. In the end, red tape will be cut, and Canadians will have better access to care and also better value for their tax dollars. Finally, our expectation is that these cost-effective changes will trigger a similar modernization of legislation at the provincial and territorial levels. Similar modernization must still be made to include NPs as qualified medical practitioners under the Employment Insurance Act, specifically to include NPs in Section 54 and 4 sections of the Employment Insurance Regulations. Further, 5 sections of the Canada Labour Code and subsection 207.2 of Bill C-44 must similarly be amended. In closing, I encourage members of this committee to support the bill, as its measures will improve access to care for over 3 million Canadians. We are of the belief that the additional sections that do not add NPs must be implemented in this important bill as well. Thank you to the committee, and I look forward to your questions.
To ask Ms. Poulin, because I think in our budget there were 2 things that were very substantial. A, the consolidation of the caregiver tax credit, and secondly, the nurse practitioner expansion. And I just wanted to hear how profound, and I'm going to use the word profound, was that change in terms for rural Canadians, I mean, put on the rural lens for Canadians having and allowing nurse practitioners to be more involved.
I can't overstate what excellent news this is. We really view it as, provided the budget is passed, that it is a win-win-win situation. My statistics are accurate that over 3 million Canadians are provided care primarily by nurse practitioners, from my in-laws who live in Peterborough to over 600 Indigenous communities across Canada. This will not mean more benefits. What it will mean is faster access to benefits that patients have long been entitled to, and this will mean significant improvements in quality of care and quality of life for many, many Canadians. In addition, nurse practitioners and physicians alike will greatly appreciate this enhancement to the efficiency under which they can deliver care.